So it's day 41, saw my physio a few days ago. The exercises I have changed slightly to include a bit more load on the calf and the tendon. Progress has been good so far. The tendon itself, especially around the rupture zone, hasn't really complained much, and sometimes I think part of it is to do with sensitivity of the skin and the area rubbing against the boot, and this strap on the boot itself even cutting in a bit and causing some concern. So I have backed off a bit from time to time, but I'm generally walking around, especially around the apartment, without crutches. I'll take the crutches out with me when I'm going down the street, that sort of thing, and using them when I feel the Achilles is aching, but it hasn't really been aching that much. That's been good. The exercises are progressing, as I mentioned. So the grabbing the cloth or the towel with the toe and scrunching the toes, that's been getting better. I'm also now wrapping the foot with an old bike tube that's been cut to apply compression to the Achilles itself, and the physiotherapist has said that that's quite helpful. The other thing I've been using is a sports rehab Tourniquet. So the idea is you wrap the tourniquet around the limb and it restricts the blood flow. So around like this, pump it up, and this is not the correct placement on the thigh, but just a demonstration. Get up to about 150, and then do the exercises. And it helps with the muscle rehab. So I've been using that as well. This is something that I've never seen before, that the physio recommended. So there's this, plus the bike tire that have been put to use in terms of compression. That should help with recovery. Next one is the bike tube. So I've taken an old bike tire tube, cut the valve off, and then cut it along the length. And the idea is to use it similar to a tourniquet and just compress the section around the Achilles like this. And it should feel like a bit of a cuddle, as my physiotherapist said. So it does feel somewhat therapeutic. Nice to have a bit of pressure around there and a bit of feeling. So then just tuck it in like that. So as before, just pointing the toe, hold for 10 seconds. And release. And 5 to 10 reps of this. You can see the blood flow is slightly restricted, and the foot is turning a little red. And then at the end of it, obviously taking this off, the idea is to restrict the blood going out, but not necessarily the blood going in. So we don't want to get deep vein thrombosis from the compression stuff. We don't want neurological symptoms like any tingliness or anything like that. No pins and needles.
I just wanted to note here that blood restriction and compression should not be taken lightly. I don't recommend trying these solely because you've seen me doing them based on advice that I was given. Restricting blood can lead to problems if you're not careful, so I would advise consulting a medical practitioner first. Warning signs that I was told to look out for were neurological signs like tingling or pins and needles, numbness, and anything that you might consider a serious side effect. It was normal for the blood flow restriction tourniquet to produce kind of a high pressure blood pump sort of sensation in the leg. It was a bit weird at first, but it became quite normal in time. I've linked to the SRT website below for further information about BFR, studies, and the SRT product itself. This is in no way a recommendation for or against, and there is no agreement or compensation between me and the sports rehab tourniquet business.
So this is a demonstration of the towel cloth exercises, pulling the toes up and scrunching together. And this is much better than when I started, so muscles are obviously improving. Slowly just pulling this towel towards me, like so. 10-15 reps. And one of the exercises that has changed a bit is to actually load up the calf a bit more with weight, and obviously over time you want to get to the point where you can do a whole calf raise with entirely with your own body weight. So it needs to be loaded up over time. So for me it's a 10 kilo weight, but I don't have one at home, so this is the next best thing that I've got for now until I get a hold of a weight. So once again, knee above the heel, keeping the shin vertical and going for 5 to 10 reps, 2 to 3 times a day with this one. So and this one's interesting because I can notice myself trying to help the calf out with the hands, and sometimes with the thigh muscle as well. And the idea is to keep the heel off the ground as a bare minimum, but really you want to be going to maximum extension. So the other one I'm doing is the standing exercise, except this time I'm slowly shifting the weight left to right, and once again accumulating 2 minutes. Aiming towards 100% weight on the right foot as the week progresses before I see the physio. Just slowly, part of it is kind of experimenting, seeing how much I can take, and a little bit of wobbliness,